Hi everyone, my name is Salvador Valdivieso and I'm doing this video for the course Nursing 4503, Nursing in the Community. And the main topic of this course will be cardiac rehabilitation, and I will be addressing some key topics associated with the importance and prevalence of heart disease. And I will start by handing you guys out this handout that it will be provided to you in person while this video is presented. Some of the key things that I wanted to address is heart disease as a whole. Knowing about heart disease is very important, and considering in this population that I currently reside in, which is the Paso del Norte region, is has a high prevalence of heart disease. So we try to address these issues as health professionals. We see this a lot in the hospitals and in the community. So this is very important to really address, and some of the resources that are allotted to you in the community is us as health professionals, and letting you guys know about the resources out there. And some of the resources that I was able to find in my research to do this video was the American College of Cardiology, which is an amazing resources that provides information in layman's term for all people that go onto the website and learn about heart disease and some other things that could be done to help limit the effects of the disease as a whole, because heart disease is associated with so many other diseases that kill people. And it's actually, heart disease is considered the disease that kills the most people yearly, and also has the highest cost to insurances, which is about $200 billion according to the American College of Cardiology. So in that website, it provides a lot of good information, and it's very accurate information, and that is very important to know what information is being obtained, because some people just go on to Google and click on the first link, and sometimes the first link would be Wikipedia, and as we know, Wikipedia is not the most accurate information in the internet. Another website that I found that is an amazing resource for all people and health professionals is the American Heart Association, which is heart.org, and is an amazing resource to all people because it provides information about heart disease and stroke, and some key tools that us health professionals use in our profession to keep people alive, which is basic life support, BLS, CPR. Also, in some instances, like myself, that I work in the intensive care unit, I use advanced cardio life support, ACLS, which gives us guidelines set by health professionals and the government for us to follow to help address some critical situations that we get presented with in hospitals or pretty much anywhere. So it provides good guidelines, and it's an amazing resource. So some of these resources are key because they're educational, and considering that it's considered a primary prevention as an educational source. Education is knowledge is power, basically, and it gives a sense of empowerment and autonomy to all of you and ourselves as healthcare professionals to manage the care of a person and giving the best quality care, which is very important to myself. To get some of this information and referrals, it's good to start with your primary care provider and ask about heart disease and what is important and how do you address concerns. And if sometimes you have a concern about heart disease, you could always get referred to a cardiologist, which deals with heart disease primarily. And some of the things that are addressed in cardiac rehabilitation is you have some of the key important, if you've had a heart attack, acute myocardial infarction, coronary artery disease, and also if you ever have to get a coronary artery bypass, also chest pain that is associated with EKG changes, your electrical waveform in your heart, and also heart transplant. And in your heart, you have these things called valves that help blood get out and about through the rest of your body. Sometimes those valves get damaged, so replacement. Also, we do this thing called coronary stenting, where they go in through one of your arteries and they open the artery up, and sometimes they put a little metal, which is called a stent. And also, when your heart gets damaged and it gets weak and is not able to pump blood effectively, you have what you call heart failure. So that's another reason to qualify for cardiac rehabilitation. And your cardiologist or your primary physicians, once you qualify through these list of things, you get referred, and you need a prescription to actually attend to cardiac rehabilitation. So it's very important. Let me see what else. Great benefits. Benefits of this is life and death. Knowing some of these symptoms and being educated about heart disease is key, because, like I said earlier, it's the leading cause of death in the world, pretty much, and it affects a lot of the quality of life of every person. It affects. So it's important that we address these concerns to the community, and as health professionals, I'm glad that I'm able to make videos like this to educate all of you on the importance of heart disease. And for further information, you could go to these websites, talk to your healthcare professional, and in the community, some of you have home health nurses that you could always ask, and we could always get you the right information to get you to the right place. So it's very important that you ask, and if you have questions, and sometimes there's limitations to some of the information that's out there, and lack of not being technology savvy could be a limitation. So that's a problem sometimes for some older population in the community. But what we want to do is create awareness. So that's one of the great benefits, is creating awareness to the disease, and it could be managed and taken care of before it causes severe detrimental effects to your quality of life, and that's what I don't want to see. And also it limits your visits to the hospital, and where obviously there could be issues every time you walk into the hospital, but it's important that we address these issues as well. So awareness is very important, and for more information, go to the websites. And thank you for allowing me to present this video to you, and have a good